everyone, it's me, Lindsay, with EquipMeOT, here today to talk about toileting while non-weight bearing. So I am non-weight bearing on my right leg as I just fractured my ankle last week. So this is a video I wanted to make because it's a common injury and it's also a common area where people have trouble. We've seen a lot as an occupational therapist of individuals accidentally weight bearing during the toileting task because it's definitely more physically demanding than we think. So I'm going to show you a couple of different ways to manage it. This is going to be primarily with crutches or a walker. So it's not going to include a wheelchair, where some individuals may require a wheelchair for periods of their recovery. So again, walker, crutches, wheelchair will be a future video. So let's get started with non-weight bearing in general. This is true non-weight bearing, meaning there should be air between your cast, boot, or foot and the floor. This is difficult to maintain for a lot of folks, especially in an emergent toileting situation. So my first bit of recommendation is don't wait. If you feel the urge to go to the bathroom, or perhaps you're near the bathroom and could try to go before you go find yourself comfortable on a couch or in bed, do it, because urgent toileting is where we see the most errors. We see falls, we see accidental heavy weight bearing, all of that. So don't wait to go to the bathroom until it's too late. I also strongly recommend that if you have urgency issues prior to your injury, using some sort of incontinence pad or brief during the period of time when you're in the most pain in your recovery period is a really great idea to conserve some energy if you have the concern of not being able to make it to the toilet in time. So don't be ashamed, it's super common and it is so worth it to prevent those accidental weight bearings or urgent issues that can cause falls and just prolong your recovery period. Okay, so let's get to it. The main thing with toilet transfers during a non-weight bearing period is know your space. If you're like me and have a space with an incredibly low toilet, this toilet is as low as they make them, I would strongly recommend adding some height. Unless you are somebody who does pistol squats or one-legged squats repeatedly for years and have a ton of strength in that weight-bearing side, this will get tiring after a while. The other thing I recommend is having something to hold on to in the bathroom. In my bathroom, I have a counter right next to both toilets on my main floor, and I rely pretty heavily on that counter during my transfers. If you don't have a counter, perhaps having a grab bar in place, and if that's not an option, you can add a safety frame to the toilet that mounts directly to it. Sometimes they come combined with a raised toilet seat, or I'm going to show you another option that involves a walker. So stick with me. All right, so let's go through the quick details of how I would do my toileting task from crutches. So the first things first, in my bathroom, I have a counter. I'm going to rely pretty heavily on that counter throughout the process because I'm going to hold on to something while I manage my pants. I am not going to attempt to balance and manage my pants at the same time. So I'm going to take my crutches and I'm going to place them someplace relatively safe. You don't want your crutches tipping over and disappearing on you while you're trying to do this. Then I'm going to hold on to my counter because that's my most stable surface. And with one hand, I'm going to manage my pants. Not going to try to balance and do it with two hands because that accidental weight bearing is way too common. So I'm going to pull my pants down far enough that I can get back. Then I'm going to reach back for the toilet. This is going to prevent me from flopping down hard. You do not want to do that. Now, you can take a minute and you can actually rest your non-weight bearing limb on the floor. This is allowed at this point because you're not standing. Traditionally speaking, a physician is going to clear you to be able to put your foot on the floor as long as you're not leaning into it. So it's just resting here. Takes a little pressure off the hip. Do your toileting task. Manage your hygiene from sitting if you can. It's going to be a lot safer if you're somebody who relies on standing for toilet hygiene. Again, just make sure you're holding on to a stable surface throughout the process. Now, for clothing management, you're going to pull your pants and your underwear up as high as you can from the sitting position. And I like an elastic waist, but you don't have to have one for this. And then I kind of separate my legs a little bit to hold it in place because you don't want them falling all the way to the floor once you stand up. Okay, I'm going to bring my crutches back in because I think it's nice to have a second point to balance here. You don't have to do this, but I like to have this second push point. I broke my right leg and that was my strong leg, so my left leg needs a little extra help. So I'm going to put my hand on the counter and I'm going to put my hand on the crutches. I'm going to lean forward, not on my fractured leg. I'm going to put all the weight on my weight-bearing leg and I'm going to push up. Now, there is air between my foot and the floor again. Now, I have choices here. If I trust myself, I can use the crutches to balance while I do my clothing management, or I can reposition my crutches back over to the side that has the most solid point to grab, which is the counter, while I manage my pants, which did not fall down because I had my legs separated a bit, up over my hips. Take your time here. Don't rush. Take your time, take a deep breath. I know you're probably in pain. I certainly am. And then you're gonna take your mobility aid and off you go. But again, so important that you take your time through that process and maintain that non-weight bearing. All right, next I'm gonna show you how to do it with a walker. All right, so let's go over how to do this with a walker. Now with a walker, you have a couple of options. If the setup was the same as what I have in my bathroom, I would pretty much do it the same as I did with my crutches. The walker can act as a secondary stabling option, but I'm still gonna rely mostly on my counter or a grab bar. But a walker has a very nice benefit in that it can replace a grab point that's pre-installed in the bathroom. So I love walkers for situations where you're gonna be visiting someplace that maybe doesn't have a great toilet setup, because you can do this trick. Now, bear with me because I'm gonna have to turn all the way around, but you're gonna take your walker and you're gonna approach the toilet facing the toilet, like this. Then you're going to push your walker all the way back so that the front of the walker is touching the toilet tank. All right, and then I'm not gonna release with both hands at the same time, but with one hand at a time, I'm gonna turn myself around. This takes a little bit of pivoting, but that walker is stable against your toilet tank. Now I have two stable points to grab to use my walker as my balance point with the toilet. Now I'm keeping my leg up off the floor like I'm supposed to. I've got this balance point here. I can use that to help lower myself down ever so carefully. Obviously, I would have pulled my pants down before sitting down. I can do my business, perform my hygiene, and then use this to get back up again. So again, toilet, pants, everything just like I showed you with the crutches, it's all gonna look pretty much the same, but I have the walker here as a balance point. Again, this is only for situations where you don't have any other option for getting up and down from the toilet. You don't have a counter, you don't have a grab bar, you don't have a pre-installed safety rail. Okay, so when I go to get back up, I can use, some people like to use these lower points to push up from. I tend to go high. It really depends on your shoulder mobility and how much strength you have in your arms. But I'm gonna kind of tuck myself back and I'm gonna pushing the walker into the toilet. And I'm gonna push up, just like that, keeping that air underneath my boot. So I'm maintaining non-weight bearing throughout. I'm gonna keep one hand on the walker while I manage my pants back up over my hips. Then I'm gonna turn again, keeping that boot up, keeping that crutch, or keeping that non-weight bearing precaution, and then I can turn and exit the bathroom. This does require a little bit of space be available in the bathroom. This may not work in the tiniest bathroom spaces because of the need to turn all the way around, but I hope that was a good idea for you if you find yourself in that situation while non-weight bearing. I'm gonna show you one other setup that works really, really well. It's kind of a best case scenario, and then hopefully you'll have all the stuff you need to be prepared. So I wanted to show you guys another setup because my bathroom that I showed first didn't have any adaptive equipment in it aside from a bidet. This toilet is way better set up for my needs while I'm non-weight bearing on this ankle. I have a Kohler Hyten toilet seat riser here, which is one of my favorite toilet seat risers because it includes features that you would get in a normal toilet seat. So you've got a slow close lid, it's just really attractive, minimal gapping. So this is a really nice riser. And then I added this safety frame, which mounts to the toilet with no legs down to the floor, which is great when you have limited space. And these flip up out of the way for users who don't need them. So this is a really nice setup that I'm finding myself using a lot while I'm recovering from my broken ankle. So I just wanted to show you how much easier this is to use, and then it really can function with any mobility solution. Walker, crutches, wheelchair, you name it. Okay, so just same thing I would do it before is I would approach the toilet. At this point, I have balance options on my counter, but pretend I don't have a counter. I can get my crutches up out of the way, and then I can use this to stabilize myself while I pull my pants down. And I love this stabilizing point, and then I can grab the other one and really comfortably lower, but I'm not going so far down. I can't tell you how much less painful this transfer is versus my low toilet. Having a higher toilet is worth it. Then when I'm done, again, I'm gonna complete my toileting. I'm gonna get my pants up as high as I can get them. I've got both these points to push from, push my weight-bearing leg underneath me so I've got that good center of balance. and I'm gonna lift myself up. Now I have that grab point, I can hold on, I can even switch sides because I have two, and I can get my pants back up over comfortably and safely while maintaining that non-weight bearing, and then I can grab my crutches and I'm on my way. So as you can see, equipment really does make a difference if you have the opportunity to add it. So there you have it, the basics of making a toilet transfer and completing your toileting while non-weight bearing on one lower extremity. I hope this was helpful for you, and if you're in this recovery, I'm in it with you. So if you need more information like this on how to stay safe and independent in your home and community, consider subscribing to EquipMeOT. Thank you.